Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa and today we are going to be going over MediHoney. But first, if you could hit the like and subscribe, it would be greatly appreciated as it does help my channel grow. So let's get started. So MediHoney is an antimicrobial medical honey that's made and prepared from medical grade Manuka honey. So it is an effective broad spectrum antimicrobial and its effect is due to its low pH of a 3.5 to 4.5. It also has a high osmolarity and this will help with debridement of necrotic tissue and slough. It also provides an anti-inflammatory effect and immune stimulation. It may be used for clients with diabetes as the honey does not interfere with blood sugar levels. So indications for use, because it is an antimicrobial, we do want to use it on wounds that have signs and symptoms of infection, a clinical infection. And most of the time this would be a local infection that we're using an actual product for because the more deeper infections we have to use an antibiotic for, and sometimes we use it with an antimicrobial, but we definitely want to make sure that we have signs and symptoms of an infection when we're using antimicrobials. So we can also use this product for narcotic tissue and slough that needs an autolytic debridement because this product does work quite well for that. And we also want to make sure that we're using it on wounds with small amounts of exudate. So just small amounts of drainage coming out of the wound because for our precautions, if we have a higher amount of exudate, it can actually create more, okay? So it depends per wound, but sometimes it does make the wounds exudate more. Okay. Another precaution is because of the low pH, it can cause localized stinging. So if your patient has had some sort of pain medication and it still persists for 30 minutes after that pain medication, you're going to want to remove it and put on a different product. Okay. Contraindications. So we're not going to use this on patients who have a sensitivity or allergy to honey. As with all wounds, we first have to prepare the wound for the product. So we're first going to cleanse the wound with normal saline and dry the peri-wound tissue. If needed, you can use a skin barrier product with this, okay? To apply, first you're going to label the patient's name on the container and the date that it was open. This is can only be used for one patient, as in all products that we use. It's just for each patient specifically. You're going to remove the cap as there is just a little silver sterile seal that does have to be removed first. And you're going to either apply this directly to the wound bed or to the primary dressing, okay? So we just want to make sure that the nozzle doesn't come in contact with the wound or the dressing because we want to keep it as sterile as possible. Obviously, every time when we open something, it is no longer perfectly sterile, but we want to keep it as sterile as possible. So we're going to apply this in a 3mm thick layer. And it may need to be thicker if you have more exudate because it will kind of wash it away. And we want to make sure that it is in contact with the wound, the whole wound base. So you're just going to have to judge it on the amount of drainage coming out of that wound of how much you have to put. But it at least has to be 3mm thick. Okay, for packing, if you're going to use it on a packing, you're going to kind of butter it onto the packing and just lightly fluff it into the wound. And we always, whenever we're packing any wounds, we just want to use one ribbon, if at all possible. Now, if it is very, very deep, you might have to tie two together, but make sure it is double knotted so it can come out, and leave a tail at the end so it's easily visible so it can pull out easily. And then you're just going to apply your appropriate cover dressing to maintain a just moist wound. Okay, we always want a just moist wound environment, so just whatever appropriate cover dressing you need. So to remove, we're just going to gently remove the cover dressing, and you're going to flush it with normal saline. If the cover dressing is sticking, just get it all saturated, and it should just lift off quite nicely. The frequency of dressing change, it is going to depend on the amount of exudate, because as I said, the exudate will kind of wash it away, and it will get soaked into the cover dressing. So we just want to make sure that we have a good amount of honey covering the wound at all times. It is good up for 7 days, okay, as long as it's not being washed away. Now, the expected outcome is that signs and symptoms of local infection are gone within 2 weeks, or that the wound is debrided from necrotic tissue and slough. This does come in 2 different tube sizes, so in 20 grams and 50 grams. That's all I have for this video. I hope you did find it educational and informative for your practice. If you haven't done so already, please consider subscribing, as it does help my channel grow. Thanks, and have a wonderful day, and I hope to catch you in my next video.